Allergies mean only rash or itch.
What are some overlooked symptoms of an allergy?
Allergies can present in several different ways.
If an allergy is left untreated, is it possible that it can cause long-term damage?
If you don't treat it properly, it can lead to asthma. Similarly, if you don't recognize some allergies, subsequent exposure can lead to life-threatening allergies as well.
Hello everyone. Welcome to the Allergy Insight Show Season 2, your comprehensive guide to allergies and allergy testing. In this special series, we are joined by leading allergy experts who will share their knowledge and expertise on the causes, diagnosis and management of allergies. From the latest advancements in allergy testing to practical advice for everyday living, we've got you covered. Stay tuned to more in-depth discussions and expert insights. Today we have with us Dr. Shrinivas Jakka, Dr. Spoorthy Reddy, Dr. Narayan Reddy and Dr. Salmaan Ali. Dr. Spoorthy, I wanted to check with you, what are some overlooked symptoms of an allergy? Like someone might have some sort of reaction, but what is a sign that could probably be an allergy?
Most people think allergies mean only rash or itch. Allergies can present in several different ways. A lingering cough, nose block, or runny nose, which has been there for quite some time, or sneezing just on waking up in the mornings or when exposed to dust. They all could be signs of allergies.
Okay.
So if it were to be infection, they usually last only for maybe 5 or 10 days. But in case of allergies, they tend to persist for weeks, months, or even years together. Sometimes even subtle cues like having dark circles around your eyes or not feeling fresh on waking up in spite of having 8 to 9 hours of sleep or feeling tired in the mornings. They all could point towards allergies, especially children when they go to school, right, with all these allergies. They feel very tired and teachers often complain that they have poor grades and then they feel asleep in classes. And not necessarily all allergies should be very dramatic, like the food allergy reactions in movies. Most of the times they are very quiet, but yet disrupt the normal life and the well-being of the person.
Noted. So it means that even small signs and symptoms can be allergic reaction rather than what we look up to in movies or something.
Absolutely, yes.
All right. Dr. Srinivas, I have a question for you. Let's say there are 2 siblings or 3 siblings and one of them gets diagnosed with some allergy. Is it possible that the other siblings might also have the same or similar allergies?
It's highly possible. We know that allergies run in families, so there's a great deal of genetic tendency. So if either of the parents have allergy, the risk of children having allergy is increased. Similarly, if one sibling has allergy, the risk of other siblings have allergy is also increased.
Okay, so it's something like probably a hereditary.
Yeah, there's a hereditary component for allergy.
Oh, okay. Thank you so much. Dr. Narayan Reddy, I wanted to ask, can kids outgrow allergies or do they need long-term care throughout their life?
That depends. What is called allergic march. Usually food allergy, atopic dermatitis start early. And of course food allergy as child grows, like by 5-6 years, certain food they outgrow, they have tolerance. Nuts and fish persist throughout life. 80-90% they persist throughout. That's the one food allergy. Atopic dermatitis particularly, they are more severe first 2-3 years. Later as they grow, they may get remission also. Some may persist throughout life also. The severity changes. But asthma, allergic rhinitis, they persist throughout life. Respiratory allergy usually persists. Manage early, particularly atopic dermatitis, manage early. What is called gateway to allergy disease, atopic dermatitis. Because the allergen enter through skin, they are sensitized. Same allergen go into GIT orally, they get tolerance. So that's why if you give allergic food early, life first year, they develop tolerance, less allergy. So that's why managing atopic dermatitis is very, very important, critical to prevent future allergic disease.
All right. Thank you so much. Dr. Salmaan Ali, how does the allergy testing work? Like, do you need just the blood sample is enough or there are other parameters to it too?
Yeah, so allergy testing is nothing but checking whether the patient is allergic to certain substances like pollen, food, animals or dust. So for this, there is a simple blood test in that we take the sample and we test it for specific IgE markers. If based on the clinical history, what the patient is showing symptoms of whether when the patient is having symptoms when exposed to dust or any animal dander or any certain food items, that specific allergen is tested and it gives a very reliable and accurate result, okay, when compared to there are other methodologies also where the reliability will vary from patient to patient and whether the patient has already taken some medication. There are a lot of factors which affect. With this specific test, it is very accurate and a quantitative test which gives an exact analysis. And even if the allergy or the IG value is very low, still it detects a very low range also. So it gives an idea of what the patient or person is having allergy against.
Okay. So, Dr. Salman, I also had a question. Let's say if there's some ongoing medication, does it affect the results?
Yeah, so the common medicines which are given for allergy, they do not affect the result of the test because this test detects the IgE directly in the blood. Okay, so even if the patient is already on medication, it doesn't actually affect the test when we are testing for specific IgE. But then there are certain different types of allergy tests. For example, there is a skin prick testing. For that testing, we have to stop the medications a certain amount of days before testing. Okay, depending on again what are the symptoms and everything. Sometimes it is 2 to 3 days, sometimes it is slightly more, but we have to stop the medication for skin prick testing. But when we go for specific IgE testing, it doesn't affect the result of the patient even if the patient is already on medication.
Okay, perfect. Thank you so much for that. Dr. Spoorthy, I wanted to understand if as a child someone hasn't had any issues, is it possible that suddenly they become allergic to something?
Yes, absolutely. This could happen. So allergies can present at any time in your life. But when you come to food allergies, usually most of the times they show up in early childhood. Let's say when the food is first introduced in the child's diet. For example, egg or milk is introduced as early as 1 year of age. So that's when they show up. But certain foods like shellfish, they can show up at any age in adulthood, though you've been having it all your life. But dairy and eggs presenting at a later time in your life is possible, but it's not quite often though. When it comes to Aero allergens, as in the environmental allergens for respiratory allergies, right? They usually present later in the childhood and sometimes in adulthood as well. So when I say Aero allergens, these are the house dust mites or the pollen from the trees, weed and the grasses. So that's the reason you often hear people saying, I was okay living in this city, but then when I moved to another city, I've started having these allergies. And sometimes also people say, I was okay, but then I've got this pet home and then I've started to sneeze. They can develop at any age. For example, drug allergy, you might be taking the drug for your life, all your life, and you can suddenly develop allergy to the medication, maybe in your 20s or 30s too. So allergies can present anytime.
Okay. Thank you so much. Dr. Shrinivas, if an allergy is left untreated, is it possible that it can cause long-term damage?
Absolutely, it can. If you look at different allergies, for example, if you look at allergic rhinitis or allergy involving your nose, if you don't treat it properly, it can lead to asthma, allergy involving your lungs.
Right.
Similarly, if your allergy of your nose is not treated properly, your tonsils and adenoids can become big, may obstruct your breathing during sleep and cause mouth breathing and snoring. Similarly, if you don't recognize some allergies, subsequent exposure can lead to life-threatening allergies as well. It's very important to identify and treat allergies appropriately.
Absolutely, that's very true. Dr. Narayan, how about lifestyle changes? Like if there is a really good lifestyle or someone with a really bad lifestyle, does it worsen allergies or does it alter the seriousness of the allergy?
Definitely, lifestyle also affect the allergies, like environmental factors like stress, obesity, definitely exaggerated allergy, asthma, like viral infections, like exaggerated allergy, post-monsoon situation, flu, exaggerated asthma. Like stress also, lack of sleep, stress, work, it can also exaggerate allergy. They change the immunity also in system.
Okay.
So the hormonal changes, immunity changes. So this lifestyle also affect the allergy. Healthy lifestyle, like you now allergists recommend yoga meditation. Definitely is improved. There is a study found yoga meditation, good sleep, good diet, physical exercise, less stress, definitely improve the quality of life. Decrease allergy episodes is proven. That's why you recommend yoga from our country, India. Going globally, they're followed.
Right. Yes, that's very true actually, very true. Dr. Shrinivas, if one finds out what is exactly causing their allergy, then is it possible that it reduces the dependency of medicine throughout their lives?
Identification of triggers involves two aspects. First is history. So when the parents tell the history of exposure to a particular allergen and then the development of symptoms, then you can suspect that that particular allergen is the trigger of the symptoms. You can confirm the diagnosis by doing allergy testings. And so these are the two ways where you can confirm the diagnosis of allergy.
All right. Thank you so much. Dr. Spoorthy, there are so many allergy tests in market. How can one know which one is authentic?
It's very important. So we have, so if you look at the newspapers, right, online, you see many ads these days offering several allergy testing, and they often bypass doctors' advice or doctors' prescriptions too. So, but the problem here is we'll have to understand that not all allergy testings are reliable. So many could be misleading. Like I've seen a few allergy testing saying that you just give your hair sample or IgG to foods. Or they would say it's a comprehensive allergy screen wherein you do the testing to everything in the planet. So they are they're not reliable tests and they're not validated. So what happens is many a times going through these tests, people who really have allergies, they might end up having a report saying you don't have any allergy, and then the vice versa too. Like people who do have allergies, they say you don't have allergies,
Yes.
right? So I usually tell my patients, follow these 3 steps. First, if you suspect yourself to have an allergy, please find an allergy specialist in your city. And then they're going to ask you several questions and then examine you. And if the allergist thinks that, yes, you do have an allergy, if they suspect you having an allergy, they would either do a skin prick test in the doctor's office itself, or they might advise you to get a specific IgE testing, which is a blood test. But you just have to be careful that it's done in a accredited, NABL accredited labs.
Yes.
So otherwise, if you just get the random test done, it's not reliable. You're going to shell out a lot of money, it will lead to anxiety, misdiagnosis, right?
Yes, that's very misleading. It can get,
Exactly.
especially for someone with an allergy. It's very difficult to understand. True. Thank you so much for that. So this one's for all of you. What's your advice to someone who's been struggling with allergy symptoms without any clear answers?
So my advice here would be, there is a lot of hope. Don't be disheartened and don't take self-help from internet and online sources.
Very true.
Right. And then, as I've told you, find the right doctor, especially an allergist in your city. And if that's not available, at least a pediatrician for your child or a general physician for if you're an adult would be the first step. And then if the doctor thinks that yes, you have allergies, then he's going to give you either a skin prick test or a blood test from authentic and reliable labs. So once you know the cause, then the management becomes very simple. They would either prescribe you medicines or just ask you to avoid triggers. And then you wouldn't believe this would make a big impact in your daily life and your well-being.
Of course. That's very true. So it feels like a small thing can make life very difficult.
Exactly.
But proper guidance and proper resolution is the way to.
Because the allergy is increasing, affecting the quality of life. Work, they're not able to concentrate, they're not able to sleep, their brain is not working, not sleeping. So they're irritable. So it is quality is affecting. Rarely they die, only few anaphylaxis, severe asthma, they may die. But the 90%, they're just suffering. So for them, you need detailed history, physical exam. First visit, you have to counsel, talk to them, listen to them. What doubts, you have to clear all doubts. And specific, relevant investigation, not better investigation, as he said. Relevant investigation. To them, tell them this is the culprit. Try to avoid. Not able to avoid, of course, we have immunotherapy also. So what best treatment can be given with available resources? Clear all their doubts, what doubt they have. First visit, you have to talk more, listen to them, counsel more.
Yeah.
Clarify all their doubts. Then definitely quality improves. They'll be very happy.
That's very true.
What I feel is, if a person is having allergy symptoms, it is always better if the person visits a specialist who has experience on treating allergy, rather than going to any general practitioner or a person who is not aware of what is the latest technology in testing as well as treatment and what is the recent protocols. So a person who is a specialist in allergy, that person can take a proper history, because taking a proper history is very important when coming to a diagnosis as to what is causing that allergy. because if there is no proper history, then a lot of money is wasted in testing because there are a lot of tests available. So if a proper history is taken and the clinician or the allergy specialist comes to a conclusion, okay, the patient is having allergy because of so and so symptoms and exposure to so and so things, maybe whatever it is, maybe a pollen or a food item or an animal, whatever it is. So then after that, that specific allergen can be tested, or in certain cases, there are profiles created. For example, if it is a food allergy, there are 2-3 items which can be checked, or animals, then there are profiles for that. So they get themselves tested with that specific test. Then after that, there are also, these are the screening tests which can be done. They come to a conclusion, okay, it might be because of this. Then there are advanced tests also, CRD panels and all those things. So that can be done at a later stage. But nowadays, because of lack of information and not going to a person who is knowledgeable in treating allergy, what is happening is people are, as Dr. Spoorthy mentioned, they are using internet and getting higher investigations which are not required at that moment. So treated by a correct specialist is very important in this scenario, and giving a proper history. Most of the times, even if the patient is not clear on what is causing, they give a very vague history. So giving a proper history is very important to treating allergy. This is what I think.
Not only history, the correlating with the reports is very important, because most of them come with so many food positive, milk positive, egg positive, cereal positive. They'll come list up and test then outside without our advice. Then say, mother, stop all food. What child going to eat? Child malnourished.
Yes.
Then immunocompromised again. So that's the thing. See, just positive doesn't mean they're allergy. They're sensitized. Positive skin prick positive doesn't mean they're allergy. They're sensitized. You have to correlate. For example, food diary maintain. After eating, within 1-2 hours, what reaction is most probable. They try to avoid that food. Again, restart that after 2 months. Again, develop a little chances that way. Mother, stop all food. बच्चा क्या खाएगा क्या पिएगा? That's practical problem we're seeing. Most of educated parents, they're coming. They're getting investigation. They're telling there's so many allergies. Sensitized and different allergies different. They have to correlate. Clinician correlates. What food to avoid, when to avoid. That's the clinician knows. Because children growing without food, how they grow? The practical problem we face day to day.
Yes.
Right?
Yes. That's very true. And I think I have a lot of takeaways from this conversation. One, starting with a good lifestyle. Second, going to the proper doctor. Third, not going to WhatsApp and internet universities. So, yes, thank you so much, all of you. Thank you for joining us on the Allergy Insight Show Season 2. We hope our discussions with these medical experts have provided you with valuable information on allergies. This awareness initiative is brought in collaboration with Thermo Fisher Scientific, providing the gold standard blood testing solutions in allergy testing approved by major health guidelines. Parents, don't let allergies hinder your child's happiness and well-being. It's important to visit an allergist for timely and accurate diagnosis, which can lead to effective treatments. Ensure your child blooms without allergy-related limitations.